Alam mo, maraming namatay. Marami rin ang may sakit. Ang pinakamataas ngayon, Metro Manila mismo. Ngayon, anong dahilan nito? Well, yung hindi maniwala sa social distancing, hindi naman naniwala sa personal hygiene. Ang hinihingi lang naman ng mga doktor, kung sinasabi ng doktor para sa iyo, kapakanan mo, is maghugas ka ng kamay, cover yourself with a mask, clean your hands, and kung wala kang face mask, magalaw-galaw ka, huwag mong paabutin yung kamay mo sa kung ano-anong bagay.
The News Day continues here on One News Now. I'm Charles Lejano. The World Health Organization reiterates that community transmission of the different COVID-19 variants has not yet been detected in the country. That's despite the surge in COVID-19 cases, particularly in Metro Manila. To give us more updates on the country's pandemic response, we have Greg Gregorio joining us live from Mandaluyong. Greg, what exactly did the World Health Organization have to say regarding the spike of COVID-19 cases in the country?
Charles, Dr. Rabindra Bayashingi of the World Health Organization said while we are indeed seeing more than 3,000 daily new cases in the past couple of days, it is still significantly lower than the 6,000 daily new cases that the Philippines has recorded at some point last year, although he highlighted that this rise in cases reflects the need to strengthen the implementation of protocols on the ground. Thus, Dr. Rabi said they are working with the Department of Health and local chief executives for the implementation of protocols, especially in areas where there is an observed uptick of cases. Now, as to the detection or the declaration of whether or not there is or not a community transmission of any SARS-CoV-2 variants in the country, Dr. Rabi said the recently detected number of variant cases in the Philippines is still limited. Thus, they would still have to work with the Department of Health, including the ongoing biosurveillance in the country, to know the extent of the impact of the variants in the country. Charles?
All right, that is good to hear. But then, Greg, could you tell us about the vaccines, the additional vaccines, rather, that we expect to arrive in the country soon, and how many vaccine doses are we expecting to get at least until May?
Yes, Charles, according to Dr. Rabi, the much expected or much awaited 117,000 doses of Pfizer vaccines from the COVAX facility may arrive in the Philippines either late March or early April. After that, the 4.5 million doses of AstraZeneca vaccine still from the COVAX facility may arrive in the country from April to May. Charles?
Right, much has been said about the priority list, Greg, about the priority list for the vaccine rollout. Do we have any updates on this?
Charles, according to Dr. Nika Hao, the chief of the DOH Disease Prevention and Control Bureau, the priority list of the government vaccine rollout is still the same. It's still topped by the 1.8 million health workers that needs to be inoculated first before the other sectors. After the health workers, we would have to vaccinate the senior citizens, then persons with comorbidities, and then the A4 or the fourth priority sector, which is other frontline workers and uniformed personnel, and then the indigent population. Dr. Nika Hao also highlighted that the A4 or the priority sector for A4 would still have to be finalized by the DTI and the NEDA, as they are part of the recovery cluster of the government. Charles?
All right, so timeline-wise, priority individuals first, but then when exactly do we expect the general public to be inoculated?
Charles, according to the Department of Health, it would still depend on the availability of vaccines in the country. First, we have to finish the vaccination of 1.8 million health workers, but apparently we only have more than 1 million vaccines right now, including the Sinovac donation and the AstraZeneca doses from the COVAX facility. According to Dr. Nikahao, we have to finish the health worker first before we move on to another sector. But then if we are going to look at the prioritization list, we will have to finish the 5 priority sectors first before we could go to the general public. Charles?
Still quite a long way to go. Do we have any other salient points mentioned during this forum?
Charles, according to Dr. Rabi, despite detection of different variants of the SARS-CoV-2 in the country, their message is still the same for the people to follow or to adhere to the minimum public health standards, which are the use of face masks and sanitation, as this is still one of the effective mode for us to prevent transmission of COVID-19. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting from Mandaluyong. NTF Deputy Chief Implementer Vince Dizon says the country still does not have enough doses to inoculate the priority population. Recall that the government earlier determined the order of priority for vaccination, where senior citizens and those with comorbidities will follow the inoculation of frontline health workers. Dizon says they are looking to expedite the vaccine rollout as soon as more vaccines arrive.
Susunod na po agad ang senior citizens at yung mga vulnerable po natin, yung may mga tinatawag nilang comorbidity o may sakit. At siguro po, Sir Ted, Ma'am Cha, para malaman din po natin, ang numero po ng ating healthcare workers ay 1.7 million. So, kakailanganin po natin po ng 3.4 million doses para po mabaktaan lahat ng ating healthcare workers. 1.1 million doses pa lang po ang meron tayo ngayon. Hopefully po by March, nag-announce po si Secretary Galvez na meron pong dadagdag na 1 million na Sinovac.
Meanwhile, vaccine czar Carlito Galvez Jr. says more and more healthcare workers are showing confidence over the vaccines available in the country. Galvez attributes this to the willingness of hospital directors to get inoculated first.
Talagang tumaas na po yung tinatawag natin na uptake o yung tinatawag nating tumaas na po yung kagustuhan ng ating mga kababayan na magkaroon na po ng bakuna. Meron na po tayong more or less 44,000 na doses na na-administered. At yung ating doses ay na-delivered na po sa mga vaccination site, mga 463,000 plus.
Senator Richard Gordon says PhilHealth's 15 billion peso fund may not have been missing, but was instead used for questionable biddings. Gordon was reacting to PhilHealth's recent denial on social media that the 15 billion peso fund was missing, saying that 95% of the amount had been liquidated. The state-run health insurer added that the fund was distributed to over 700 hospitals nationwide. But speaking with Radyo 5's Ted Filon, Gordon said that, based on their probe, PhilHealth was, quote, atrociously paying for overpriced projects and was releasing funds to favored hospitals. The senator, who also chairs the Blue Ribbon Committee, says they're eyeing to file a case before the ombudsman.
Talagang nakakagulat yung mga binabayad nilang malalaki. Kaya doon kami nag-focus sa investigation. Ang nangyayari, kung hindi ka makikipag-cooperate, hindi ka mababayaran. Pero kung meron kang cash sunduan sa kanila, palagi ka mababayaran.
We'll be back with more stories after this quick break. Keep it here on One News. You're still watching One News Now. I'm Charles Lejano. Due to the rising number of COVID-19 cases in Caloocan, the city government is set to reimpose several measures to slow down the spread of the virus. JC Cosico joins us live from Caloocan to tell us all about this. JC, good afternoon. What additional protocols will be reintroduced in the city?
Charles, beginning March 10, Caloocan City will reimpose the use of color-coded quarantine passes for market purposes in a bid to control the spread of COVID-19. Residents with green passes may go out to buy goods every Tuesdays, Thursdays, and Saturdays, while those with orange passes may go out every Mondays, Wednesdays, and Fridays. Those who lost their quarantine passes may go to their respective barangay halls for the issuance of a new pass. Market vendors at the Camarin Kiko Market said these measures will affect their sales, although they have no choice but to adjust to curb the spread of the virus. The 10 p.m. to 4 a.m. curfew will also be reimposed beginning Wednesday. Those going to work or home are exempted. Caloocan City Mayor Oscar Malapitan says they have noticed an increase in cases. That's why they have to enforce additional measures. But the mayor denied that they will undergo lockdown. Charles Mayor Malapitan also signed an executive order encouraging the use of the Stay Safe PH system for contact tracing purposes in both public and private establishments. Now, cases in the city have reached over 14,000. Back to you.
Thanks for that, JC. That was JC Cosico reporting from Caloocan. Some frontline health workers at the Jose Delgado Memorial Hospital in Quezon City have been vaccinated against the coronavirus as of today. Medical personnel consider this a victory, not just for themselves, but also for their patients, who are mostly female. Laila Pangilinan is reporting to us live from Quezon City to tell us exactly why. Laila, what do you have for us?
Charles, some members of the medical staff here at the Jose C. Delgado Memorial Hospital received their first dose of Sinovac shots today. The vaccination came a day after International Women's Day, which calls for a celebration, as most of the patients here are women or pregnant women. This means patients who are about to give birth, as well as their soon-to-be delivered children, are better protected from the virus, as their OB-GYN and other medical personnel have received a COVID-19 shot. 800 doses of Sinovac were allocated for the hospital. Only 70 medical staff initially volunteered to receive Sinovac, but a total of 120 have been vaccinated so far today. The vaccine rollout at the facility was spearheaded by Delgado Hospital's president and CEO Joel Rodriguez, who received the first jab. But despite the vaccinations, Medical Director Dr. Reiniero Adbad reminds their patients as well as the public not to be complacent and to continue observing health protocols, especially amid the rise in COVID cases. Delgado Memorial Hospital is a part of the MVP Group, which is also set to acquire vaccines as a conglomerate. But since the government has already given the hospital a sufficient supply of vaccines, the excess shots procured by the MVP Group will be allocated to other MVP employees who are also part of the priority list. Charles, the inoculation here is until 5 p.m. today at the Delgado Memorial Hospital, and they plan to finish their vaccination drive by Friday or within next week. And by the way, Charles, for those who got vaccinated or who volunteered to be vaccinated today, they received a special prize of ice cream. That's the latest here, Charles. Anong flavor gusto mo? Balik muna sa'yo.
You can never go wrong with ice cream and belated International Women's Day, Laila. That was Laila Pangilinan reporting live from Quezon City. And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. We are One News. Mask, wash hands, and stay safe, Philippines.